local election headquarters, continuing coverage as President Trump and the First Lady Melania have tested positive for COVID-19. Now, we know they may have been exposed to the virus through a White House senior aide, Hope Hicks. Trevor Shirley, our Washington correspondent, joins us from D.C. now as these details develop. Thank you, Trevor, for joining us.
Yeah, thanks for having me.
Yeah, so we know everyone at Tuesday night's debate in Cleveland was tested for COVID-19. So what window does that leave? When did the First family contract COVID?
Well, in terms of specifically when or where or from who they contracted it, that's something that, nobody will ever be able to determine specifically, and that goes for anybody that's diagnosed for this disease. What we know at this point is that Hope Hicks, who's arguably one of the president's closest advisors, she tested positive for the virus yesterday, and then it was several hours after that that President Trump and the First Lady both tested positive as well. That news coming out very early this morning. In a tweet from the president himself confirming that he had this diagnosis. So far, though, we know that Vice President Mike Pence and his wife Karen have both tested negative. Ivanka Trump and her husband Jared Kushner have both tested negative, as well as the president's son Barron. He's also tested negative. So at this point, there are more negative diagnoses around the president than there are positive ones. We've also learned in the past hour that Democratic presidential nominee Joe Biden has also tested negative for the virus.
Some people are speculating on social media this could be a false positive. Do you believe, as commander-in-chief, he would have been tested multiple times for this before going public?
Well, the president is one of those people that is tested every day, if not multiple times a day. In terms of the specific, type of test or the process for that, that has not been made public yet. But one would assume that if the White House were going to put out this information and the president were going to confirm him itself, they would be relying on more than just a single test to confirm this.
The biggest development from the chief of staff this morning, I would say, is the White House learned of Hicks's diagnosis Wednesday. So why didn't the White House disclose this information then and start testing the White House staff then, rather than continue on to that fundraiser in New Jersey?
Well, that's something that that Mark Meadows, the chief of staff, really didn't get into, but it does raise a lot of questions. If the White House and potentially the president knew about Hope Hicks's diagnosis, why did he continue and why did they decide it was in his best interest to continue campaigning, especially as it related to the fundraising event he did last night that was a face-to-face private fundraising event in New Jersey? That's one of a number of questions that are being asked today.
Trevor, thank you for clearing a lot of stuff up. Before you go, though, one last question for you. The president's doctor says, quote, "I expect the president to continue carrying out his duties without disruption while recovering." So what do you think this has to say about future rallies and the next debate even?
Look, I keep telling people this morning, this is just one of the million-dollar questions that we're asking, that we're looking at this morning. The president is potentially going to be quarantining for at least 10 days, if not longer. So that really calls into question the first half of the last stretch of campaigning. We're only 32 days away from the election. So we've yet to hear anything from the campaign in terms of what their plans are, how they are envisioning the president's shift to campaigning, potentially virtually or phone calls, phone campaigning, something that he had done somewhat off and on, at least over the past month or so. And really a lot of that depends on how the president's feeling. Whether or not his symptoms continue to progress or get worse could potentially determine what he's able to do in terms of campaigning. So that's certainly something we're going to be watching here over the next few days to a week.
Yeah, it'll be interesting to see how the campaign responds and moves forward with this. Thank you so much for your time, Trevor.